Hey, Dr. Derek Nielsen here, the owner of Kaizen Physical Therapy. Today I want to talk about knee popping. I have a lot of people that come into the clinic who ask me about when they move their knees, say from a sitting to a standing position, or if they're squatting or lunging, they have some knee popping in the knees, and they want to know what the problem is. So today I want to talk to you what the far majority what the problem of the knee popping is, and what the solution really looks like. So first, let me ask you is, does the knee popping hurt? Is there pain when the knee pops, or is it just the sensation of popping? That's question number one. So if there's pain, there can be something going on in the joint. So the kneecap can be popping in the joint, and there can be some irritation either on the backside of the kneecap or some irritation on the bone that it articulates with into the leg. So one of those, the cartilage within there can get irritated, and if it's popping and there's irritation, chances are that cartilage is a little bit irritated. If there's no pain, then popping is usually a normal sensation, and it's not much to worry about. However, if you do have knee pain in general, so not necessarily the popping hurts, but you have knee pain in general, what can happen is the muscles around the knee, your body's automatic response to pain is to tighten up, and it tightens up to protect. Before I forget, if you're looking for a solution to pain and you're serious about trying to find one, I did just make a book specifically for you that'll dive into stuff like this and a whole lot more that'll start to help you progress in your pain and feel a little bit better. Go ahead and download that book. You can find it at thepainreliefbook.com, and it's free for download. But your body's automatic response is to protect. And so what does it do when you have pain is muscles will tighten up. And it's not just the area that hurts that the muscle is going to tighten up. It's the area everywhere around that area. So for example, if somebody has knee pain, you're going to get the muscles in the front of the knee are going to tighten up. You're going to get the muscles behind the knee, so the quads, the hamstrings will both tighten up. Even muscles up into the hip can tighten up, as well as the calf. And so when you have multiple areas that are tightening up, so you have muscles pulling up, you have muscles pulling down, you have muscles pulling to the side. And so what can happen is, as you've got all these muscles pulling in different directions, it changes the way the bone sits. And so when you move, the chances of you having that popping is a little bit higher because you have muscles pulling in all different directions. And so it's usually not a bad thing. However, it's usually tied to some sort of pain because, again, your body's automatic response is to protect, and it tightens up around that area. And so it's, again, it's not usually something to worry about, but the pain is. And oftentimes what will happen is once you get rid of that knee pain, all of a sudden the knee popping starts to disappear. I hear that a lot with knees. The neck is the same way. And again, it just comes back down to muscles tightening and pulling in different directions. And once the pain goes away, the popping goes away. But again, if there's no pain associated with the knee popping, it's usually not something to worry about. If there is pain associated with the popping, the joint is probably a little bit irritated, and you should get that checked out. As well as pain in general, get that checked out. But go ahead and download the book that I made just for you so you can learn a lot more about your body and what you need to do. You can find that at thepainreliefbook.com. And thanks so much for listening. I'll talk to you soon.